So if you go for rounds or anything, the word septicemia is still being used quite wide. But I think for the sake of getting on track with others, we're going to use the term, we're going to cover the term systemic inflammatory response or sepsis and sepsis, okay? If I'm going too fast, let me know, okay? But usually it's quite fast because it's all in the notes. Have you all tried the Quizlet that I put on Padlet? Anyone tried the Quizlet?
Doctor, is it the one where we flip the cards? Is it that?
Yeah, you can do a lot of things. Actually, there's games. It's supposed to make your learning more interesting because sometimes certain subjects, they're quite dry, right? Like, for example, this subject is basically a lot of terms and a lot of kind of like comparison. So Quizlet is just another platform. You can use the flashcard. You can do a few other games there. So usually what I do is I do live games. But of course, you know, with the situation to like now, I'm not too sure whether, that's why I thought of having a 2 hours class, but I thought, nah, man, just get it done and over with. Maybe we can try another time, right? Okay. So for today's class, I hope you guys do try the Quizlet. You know, if you think the lecture notes are just too dry, at least the Quizlet, you can play some games on it, and you know, usually it's better. So today, there's a few definitions. I think you've come across all these definitions. The first one that I'm going to introduce is toxemia. All right. So toxemia is presence of toxins in blood. All right, is a condition resulting from the spread of bacterial products or toxins in the bloodstream. And the condition results from metabolic disturbances. Toxic shock, okay, is caused by the presence of large quantities of potent toxins in the bloodstream. Now, they cause peripheral vasodilation, precipitate in fall in blood pressure, and then you get pale mucous membrane, you get hypothermia, you get tachycardia, as well as muscle weakness, okay? The next one, we'll go to septicemia. All right, septicemia is a systemic disease associated with the presence of pathogenic microorganisms and their toxins in blood, all right? So for toxemia, it's just the toxins, but for septicemia, it's the presence of the pathogenic microorganism. The resulting syndrome is a combination of signs of toxemia and hypothermia. All right, you get conjunctival petechiation and evidence of localization in the joints. Do you all attend the rounds today morning? To join?
Yes.
Yeah,
Yes,
yeah. I saw the number of students is less, but at least, you know, for those who join, I think you'll, if you've covered, you'll, you know, you'll understand a bit better with the first case, right? With the author. There's proof of positive blood culture on smear, for example, in anthrax, pasteurellosis, or colibacillosis. All right, so septicemia, the term is still widely used as well, but if you look at the slide in rounds, it's basically SIRS, okay? But we'll come to that. So how about bacteremia? Bacteremia is presence of viable bacteria in bloodstream, all right? And then for SIRS, SIRS is actually systemic inflammatory response syndrome. It is a syndrome, all right, because it involves systemic inflammation, all right? It's a clinical syndrome. That means you have a lot of other signs. Clinical syndrome caused by systemic inflammation of infectious. It can be either two, infectious or non-infectious, right? In dogs, the diagnosis of SIRS is based on fulfillment of at least 2 out of 4, right? It could be tachycardia, tachypnea, hypothermia, or hyperthermia. And then you can either have leukocytosis or leukopenia or bands, right? It's similar to humans as well. So in humans too, but of course in humans, they are really more, I would say their definition would be more in detail and very specific, okay? So how about sepsis? So what is sepsis? Sepsis is actually SIRS, okay? Systemic inflammatory response towards infection, okay? That's the difference between SIRS and sepsis. So sepsis is SIRS response towards infection, involving infection, but SIRS is actually a clinical syndrome or systemic, due to systemic inflammatory response, either due to infectious or non-infectious, okay? So the next one we'll go to severe sepsis, septic shock, and MODS or ARDS, ARDS. Okay. Now severe sepsis, this terminology is not currently being used. Okay, either in humans or in various veterinary, because there's a lot of overlapping of the terminology. But just because you'll come across it when you go and search online, or if you look for further, if you look for your reference, sometimes they still describe severe sepsis. Okay, so severe sepsis is a systemic inflammatory response to infection, all right, which is associated to organ dysfunction with the manifestation of hypoperfusion or hypotension. So this term is not being used, but for septic shock is a systemic inflammatory response to infection, all right, with hypotension, despite giving adequate fluid resuscitation, okay? So that means even though you give fluids and everything, your animal still come down with hypotension, and you'll get hypoperfusion, and that one you call septic shock, okay? So another consequences of SIRS is multiple organ dysfunction syndromes or MODS, right? Now, you term it as MODS when you have altered function of 2 or more organs secondary to SIRS, okay? Whereby the hemostasis cannot be maintained without intervention. Another one that is can be included in MODS is when you have acute respiratory distress syndrome, all right, whereby you get pulmonary inflammatory disorder characterized by non-cardiogenic pulmonary edema, neutrophilic inflammation, and hypoxemia, all right? Okay, let's look at MODS. MODS is the devastating consequences of sepsis, all right? The pathogenesis of organ failure, for example, in renal failure during sepsis is multifactorial, but it always, they say, related to the mitochondrial dysfunction. Right, you'll get circulatory collapse, microcirculatory changes, hypoxemia, and inflammation. So you get tissue ischemia, you get a reduced mitochondrial and cellular function, and then you get organ damage, which may be permanent or may resolve if the sepsis is resolved, right? Some forms of organ dysfunction, like acute respiratory distress, results from inflammation. And during the initiation of ARDS, you get inflammatory mediators and microbial products which activate the pulmonary macrophages. Now, this will result in vasodilation, vascular leak, pulmonary edema, and neutrophilic inflammation. So when you learn a little bit on SIRS and sepsis, when they are presenting in rounds, I think you would understand better. You know, oh my goodness, you see, my baby's going to eat. Okay, so what do you get? So hold on, let me put my cat away. Okay, so for SIRS, what can cause SIRS? A lot of things, okay? For example, in non-infectious, you can get trauma, it can be due to burns, okay, pancreatitis, neoplasia, all right, but sepsis, oh goodness, hold on. Can you see this guy? Okay. Yeah, he is disturbing. He loves to step on my keyboard, all right?
What's his name, doctor?
He refused to respond to Toshi, Gypsy, what else did I name him? Toshi, Gypsy, or Georgie, and he only responds to baby. Very, but doesn't fit his character. He's a devil. So I want to call him Satan, but I don't want. Okay, a very bad mommy. All right, okay, let's go back. So for examples causing SIRS, it can be non-infectious and it can be infectious, all right? So for non-infectious can be burns, chemicals, heat stroke, immune-mediated disease, all right, neoplasia, pancreatitis, or trauma. Whereas for infectious, you can get bacteria, fungus, all right, gram-negative, gram-positive, protozoa, and viruses. So you can see here the diagram here, right? It makes easier for you to understand. So anything that involves infectious is called sepsis, okay? But if it's just non-infectious or any sterile inflammatory disease, you call it SIRS, okay? Okay, here again, just to make you understand the consequences of SIRS or sepsis. So again, SIRS can include infectious or sterile inflammation. Once it involves infection, you call it infection if there's no inflammatory syndrome, all right? But once you get a systemic response, you call it sepsis. And then when you have, okay, we'll skip severe sepsis, but when you have sepsis with hypotension, even though with adequate resuscitation of fluids and hypoperfusion, you call it septic shock, okay? So when I'm sharing with you some of these diagrams, they're all, it's similar, okay? If you have to remember, all mammals, they have similar physiology. So this, most of them, they're from humans. So for example, like for SIRS here, right? These are actually for human, okay? But it's almost the same criteria, okay? But I just want you to take note so that you don't remember these numbers, because the temperature for animals or dogs is different from humans, okay? So, but the basic concept is the same. So for example, when you have any infection, hold on. Okay, sterile causes, again, like burns, pancreatitis, trauma, bleeding, or when you have infection with gram-positive, gram-negative viruses. If you have a local inflammation and if recovered, you know, the animal will, you don't have any complication when it's just local infection, but somehow when it involves systemic, the infection goes through the blood circulatory system, and that's when the inflammatory reaction will happen. So if you get SIRS, if you get 2 out of 4, okay, in dogs, if it recovers with the intervention, it may survive or it could lead to death, right? Depending on how severe it is, okay? But again, if you have proven infection, it's called sepsis, okay? And then if this is not adequately corrected or too late, and then you can lead to organ failure, then you will lead to shock or septic shock. Shock is just when it involves non-infectious, but when it involves an infectious, it's called septic shock, and again, can lead to death, all right? So severe sepsis here, when you have hypotension despite adequate fluid resuscitation, and if you can't fix that, it will lead to shock or septic shock. Again, these are all the diagrams so that you would understand how it leads to death or towards the end, which is the septic shock, okay? So again here, just to remind you that these are all human values, because the next value for the dogs and cats are on the next page, okay? So again here, so these are for dogs and cats. The temperature, if you have higher than 39.7 or less than 37.8, okay? When the heart rate is more than 160 for dogs and 225 for cats, or less than 140, all right? For respiratory rate is more than 40 for dogs and cats, and for the partial CO2 is 32 in dogs, all right? And the white blood cell is more than 12,000 or less than 4,000 in dogs, and more than 10% bands, okay? So these are some of the important values. So in dogs, they said if you have 2 out of these 4, then you can classify them as having SIRS, okay? So the next one is sepsis, okay? Sepsis is just from the Greek word is decomposition of animal or vegetable organic matter in the presence of bacteria. So clinically, sepsis have come to mean infection with concurrent clinical evidence of systemic inflammatory response, all right? Now, previously, sepsis and bacteremia are considered synonymous, but of course, they realized that sepsis is actually related to widespread inflammation and not because of the widespread infection. So bacteremia, you can have widespread of the infection of the bacteria or organism, but without causing SIRS. But sometimes, I guess, when the immune response goes down, and then that's when the body will react to it, okay? In dogs and cats, all right, bacterial infection is the most common cause of sepsis. For example, E. coli, all right? Other microorganisms, like mentioned before, fungus, parasite, virus, okay? Now, for dogs and cats, most of the time is associated with peritonitis, all right? In dogs, it's also involving the respiratory tract. In cats, again, peritonitis, pyrothorax, or hepatic abscessation, okay? So the pathogenesis, let me just move this a bit, all right. Now, the consequences leading to sepsis is really complex and not really understood. Okay, basically the initial phase, microbial products, for example, endotoxin from gram-negative bacteria, exotoxins, all right, or super antigens from gram-positive. And now these are the ones that will induce the systemic inflammation through activation of immune cells, all right? There'll be induction of systemic inflammation, may start at the local site, as as you've seen in the diagram just now, like an abscess, okay, or on the local site. For sepsis to develop from a local infection, inflammatory mediators or the microbial products must enter your systemic circulation, all right? And then it will activate further inflammatory cells response. The diagram is on the next page, okay? I think the diagram will help you to understand better. So during gram-negative sepsis, for example, the lipopolysaccharide or the LPS will be released. Okay, this diagram. Now, the LPS, the lipid A portion on the LPS will bind to the LPS binding protein, which is this one. Okay, it will bind. So now this complex, all right, now this complex, hold on. Hey, hold on, 1 minute. Okay, now the LPS and LPS binding protein complex will be recognized by the macrophage cell surface receptor, which is the CD14. You guys have all covered your immunology, right? Your immunology class. Have you all covered? Have you all done your immunology?
We're taking it now.
So I think some of these terms or these macrophages and all the interleukins are not so foreign to you, right? For immunology, it's much more, isn't it? So this one is the basic one. So I think you'll understand it better as you go through. So the main function of this CD14, okay, it will transfer the LPS to the toll-like receptor, which is the TLR4, and the MD2 for subsequent cellular activation. Now, once this LPS binds to the cell surface receptor, the macrophages becomes activated. All right, now the intracellular signaling through activation of the nuclear factor kappa B, okay, beta is, kappa B, sorry, is initiated, whereby this thing will lead to multiple inflammatory mediators. For example, hold on, let me show you here. So once this thing, macrophages, the LPS binding protein binds to the LPS, to the lipid A, and then it will be forwarded to the receptors here, CD14, TLR4, and then the macrophage will be activated, and then it will go towards, the system, and then it will activate a lot more mediators, and then these mediators will further lead to all the cascade. For example, it'll lead to fever, coagulation, it'll lead to vasodilation and vascular leaks. You'll have organ dysfunction, and you get cellular infiltration. Okay, for example here, okay, here. Interestingly, many physical and chemical stimuli are capable of activating this nuclear factor kappa B, all right? Now, this may explain why there's so many causes that could initiate SIRS, right? The inflammatory outcome is similar in many cases. So no matter whether it's infectious or non-infectious, the clinical sign that you see is similar, okay? Because of all this, because it started because of all this interleukins and all the inflammatory mediators, okay? And then, okay, so there are many inflammatory mediators involved with sepsis and SIRS. Okay, the example of important mediators in cats and dogs are the tumor necrosis alpha, interleukin-6, and nitric oxides, and also leukotrienes, okay? So sepsis is not simply induction of inflammation, but rather induction of pro-inflammatory components of the immune system, okay? To the extent that they overwhelm the normal anti-inflammatory regulatory system, they overwhelm the body, allowing the inflammation to go unchecked. That's why it goes all over and affects a lot of multiple systems, okay? Ultimately, the unchecked pro-inflammatory cascade will lead to inflammatory cell inflammation, altered thermoregulation. Remember your fever, okay? It will affect the hypothalamus. It causes vasodilation. It causes leakage, coagulation, hemodynamic instability, and multiple organ function failure, okay? So again here, in this diagram, you can see when you have bacterial endotoxin, you have that widespread of leukotoxins leukocyte activation, and then leading to massive cytokine release. It will lead to diffuse cerebral dysfunction, all right? Increased leukocyte oxygen consumption. It will lead to febrile response, which is animal showing signs of fever, all right? Increased whole body metabolic rate, and then acute lung injury. No, these things will lead to hypoxic respiratory failure, all right? So again, because of these cytokines, it will lead to vasodilation and increase in capillary permeability, leading to lung injury. Okay, you will have hemodynamic collapse, leading to shock. So that's why if you attended the rounds today morning, the one with the otter, so you will understand a little bit how, that's why these are all occurring. That's why you see the clinical signs in the otter. Okay, impaired cardiac contractility due to impaired metabolite use. Okay, and then you get decreased renal failure function, because of the direct cytokine effect, leading to acute renal failure. What else you get? You get poor hepatic synthetic function, leading to coagulopathy, all right? And then you have widespread complement and coagulation cascade activation, leading to DIC, okay? Then you'll have a lot of problems with, you'll see DIC clinical sign and microvascular damage, which will further lead to acute renal failure and other DIC. Okay. So you can see that if you don't intervene, the most probably the animal will die, isn't it? So the clinical aspect in cats, in dogs, okay, you can either have a hyperdynamic or hypodynamic response during sepsis. Okay, hyperdynamic response is characterized by fever, brick red mucous membrane. All right, you have tachycardia and bounding pulses. Now, as the disease progresses, you'll get the hypodynamic response. Now, hypodynamic is characterized by hypotension, pale mucous membrane, and hypothermia. Okay, often dogs with gastrointestinal or respiratory tract signs are associated with endotoxemia. I think I have a picture here. All right, this picture, for example, sometimes I think next time I'll add more pictures. I think this one not so clear, but I think you can still see it's brick red mucous membrane in the dog in the hyperdynamic phase of SIRS. Okay. Now, what do you find in the physical finding during hyperdynamic phase? All right. Now, if you ask for history or when you do PE, basically you can get history of diarrhea, lethargic, okay, loss of appetite, mental depression, or vomiting. Okay, that's the basic general ones. But when the animal comes in during the hyperdynamic phase, you'll get that bounding pulses. All right. Here it says that cats frequently do not develop these signs. You do get the brick red mucous membrane as shown in this diagram. You get fever, right, tachycardia and tachypnea. But in advanced disease, if the animal comes in much later, that's when you get hypotension, okay, hypothermia, pale mucous membrane, and very weak pulses. Okay. So what other things do you see? When you do CP, you get either hyperglycemia or hypoglycemia, hypoalbuminemia, exothymia, all right? Hypobilirubinemia. You can remember because of all the cascade, it will affect a lot of organs. So you get a lot of other readings in CP as well, okay, alterations. You get leukocytosis, all right? You will see anemia or thrombocytopenia. So sepsis are commonly reported involving MODS, which is multiple organ dysfunction in humans. However, in dogs and cats, they're not known, okay? But it doesn't mean they're not known means they're not okay? Hold on, wait, what? Hello?
Hello.
What happened?
Yes, doctor.
Wait, I'm trying to, hold on. Just let me see because I heard like a lot of people leaving or, okay, never mind. Oh goodness, I forgot to record the session. Damn, hold on. Wait, let me just see. I forgot to record. Goodness. Okay. Let me just share again. Okay. So in animals, in cats and dogs, that even though they're not known, sepsis, cats and dogs with sepsis, although cardiovascular, it does affect the cardiovascular, GI, hepatic, renal, endocrine, and also respiratory dysfunction has been recognized, okay? I think it's just they do not know how the mechanism are involved. So coagulopathy, due to including decreased protein C and antithrombin concentration or prolonged prothrombin time, and increased D-dimer concentration has been documented in dogs with naturally acquired sepsis. All right, many dogs with sepsis will have myocardial dysfunction and vasodilation leading to hypotension. Poor perfusion, these are all we have discussed just now. Poor perfusion, tissue hypoxia, and cellular metabolic derangement can lead to metabolic acidosis. All right, cats with severe sepsis may develop clinical signs. For example, similar to dogs, with a few exceptions. Bradycardia, hypothermia, and abdominal pain are frequent unique findings. All right, cats may appear to develop septic shock more readily than dogs. Typically, the hyperdynamic phase is not recognized during feline sepsis. So those are the small things that they notice the difference between cats and dogs, okay? So I'm discussing more on cats and dogs because sometimes it's quite hard to find reports on large animal, but I think in the future I'll try and find if they have any updates, and then I'll include that. And furthermore, with cats and dogs, because you commonly come across these cases in the hospital, okay? So again, this one is just to show you a dog with trauma resulting in global activation of the inflammatory system, all right? And then this one is example when you have a suture breakdown from anastomosis in dog following foreign body surgery, so leading to SIRS, okay, and sepsis, especially when it involves the GIT. So how do you diagnose, all right? The diagnosis is basically through history. Again, every time you want to go through diagnosis, history is really important, right? You do your physical examination, check the blood pressure, do complete blood count, check your serum bioprofile, urinalysis, blood gas analysis, and coagulation profile, okay? The diagnosis of sepsis is accomplished by demonstrating evidence of infection, all right, and SIRS, okay? So infection may be identified via culture, cytology, histopath, and or serology. If bacterial infection is suspected, you do culture and sensitivity, right? Based on the clinical findings, specimens should be collected from either blood, urine, okay, the wound exudate, the peritoneal fluids. You can do from your bronchoalveolar lavage fluid or your synovial fluid. So patients with suspected bacterial peritonitis, now you can check also for the glucose concentration, all right? You compare between the glucose concentration in the blood with the peritoneal fluid. When you have a difference of more than 20 milligram per deciliter between blood and peritoneal fluid glucose concentration, you can have a diagnostic for septic peritoneal effusion, okay? In some cases, identification of infection is difficult, okay, or delayed. Presumptive diagnosis of infection can be based on clinical picture, all right? And important to remember that there are many causes of SIRS which are non-infectious of origin, okay? So this one again, just to show you if you do a cytology, this is from the peritoneal fluid from a dog with bacterial peritonitis, okay? And then C is sterile peritonitis, but A and B here is involvement of bacteria, okay? Suppurative inflammation is noted. Okay, you can see here, if you see on your desktop, maybe you can see the bacteria, all right? And then you see a lot of inflammatory cells, but in this one, you don't see any inflammatory cells. So this one, you can say it's sepsis, all right? Because it involves infection. So what do? You already know the clinical signs, you do your PE, and then you do your diagnosis, but how do you treat? So the most important aspect is identification and eradication of the inciting cause. So if you think it's because of a wound or because of the ruptured, like the suture site, like for example in the diagram before, break in the suture site, what you can do is you debride, do wound debridement, do cleanup, and then you have to fix it. Okay, early antimicrobial treatment is critical for survival. Administration of IV antibiotics should be initiated as soon as possible, within an hour, they said, okay? If you think it's due to sepsis, you have to give it as soon as possible, should not be withheld pending culture results, okay? If you think, oh, I think we have to wait for culture, culture takes time. By the time you want to wait for culture result, your animal will be dead, okay? So you can use broad spectrum bactericidal, okay, like fluoroquinolones, IV, okay, you have to initiate as quickly as possible. Antibiotic therapy should be selected based on the most likely organism and the site of infection, right? Whether it's on the GI, whether it's involving the bones or the joints, okay? And then surgical debridement may be necessary for the infection control. Once culture-specific antibiotic sensitivity is determined, then you can change to antibiotic with narrow spectrum, all right? And then you have to remember maintenance of tissue perfusion, management of organ failure, and aggressive supportive care is very, very important. Okay, there's no point if you just give antibiotic, but you're not covering for anything else. So this diagram, it shows you the algorithm for the diagnosis and treatment of sepsis in dogs. All right, for example, in the initial resuscitation for the first stage, when you have hemodynamic stage, okay, when you want to elevate the cause, you can start with your broad spectrum antibiotics, all right, bactericidal, rapid, the best is to give through IV, all right. Surgical debridement is also indicated if you know it's involving surgical procedures. Now, hemodynamic, what you can do, the most important thing, when an animal is admitted to a hospital, what is the most important thing that you need to do? Anyone? What is the first thing that they do? Anyone want to answer that?
They check the weight and the temperature.
Weight and temperature, yeah, I mean, okay, but usually, okay, when the animal comes in and it's an emergency, the first thing you do is to put on an IV pod, right? Why do you think an IV pod is very important?
To stabilize the patient in terms of the dehydration and
Yeah, you need to stabilize. Yeah, you need to make sure there's a patent pathway that you can give medication IV, right? You can give fluids, you can take blood, everything is from the same pot, right? So you need to make sure, because sometimes if you delay that, just imagine if you're busy doing everything else, but you did not put the IV fluid, you are putting the animal in a lot of risk, like for, you know, the animal could be going into shock and you need to correct the perfusion immediately, right? So the best thing, the first thing, usually most important thing to do is to put an IV pod, giving balanced fluids, all right? You can use crystalloids or colloids. For hypotension, there's a few drugs you can use. Some recommend norepinephrine, all right? Because to improve the blood pressure, if with the fluids is not helping, all right? Resuscitate to goals, right? Now, what else they will do for long term? When the animal has been hospitalized for more than 6 hours, you have to consider, if you have the animal survive within that phase, you have to consider the nutritional part, all right, and the GI, because you remember the GI, sometimes with all the cascade, it can lead to permeability of the GI, and then you can get ulcers, you know, and then there's a lot of consequences of bacterial entering the systemic from the GI. So what do you need? You need to consider feeding, using feeding tube, all right? You need GI protectants, for example, like omeprazole, okay, sucralfate. Nursing care, for example, strict aseptic technique, wound management, frequent turning of the animal, physical therapy, blood and bowel management, all right? Cellular oxygenation, you have to maintain normal blood pressure, you have to check, all right? Ensure the animal is getting enough oxygen. And then pain management, you need to consider opioids, all right? So avoid NSAIDs or corticosteroids because they worry that you will lead to further like ulceration in the GI and everything. So, and of course, the hemodynamic part is really important, okay? So for example, this is a normal condition in ICU, okay? So as you can see here, they have a lot of monitors to monitor. So here is a critical patient receiving total parenteral nutrition through jugular catheter, multiple fluids, drug infusion, oxygen therapy, and close monitoring with the ECG, all right, and direct arterial blood pressure measurement. So this is their intensive unit care. So when you enter, I should get one picture from UVH, okay? So when you enter the ICU unit, these are the animals that you really have to, take care of, because they can go anytime, and they're and the possibility of going to multiple organ failure is high, and they could go to shock. So the prognosis, the mortality rates for dogs and cats with sepsis and SIRS are quite bad. They can die like 50 to 80%, all right, will die despite the aggressive management. Poor prognosis when you have hypotension with anemia, hypoalbuminemia, increased ALT, meaning the liver is not cannot cope. Inflammatory mediators involvement like TNF and the interleukin-6. New therapies are being aimed at making it more aggressive supportive care, and the need to restore the pro-inflammatory and anti-inflammatory balance. Okay, so the prognosis can be quite bad, 50 to 80%. Okay, so again here, just to show you a dog with acute respiratory distress syndrome due to SIRS, following intubation for unsuccessful cardiopulmonary cerebral resuscitation. You can see a lot of blood, fluid poured out from the ADT tube, all right? From the thoracic radiograph, you can see severe bilateral alveolar infiltrates, okay? So it's just bleeding. You can remember the vasodilation, the leaking of the blood vessels and everything. So these are the consequences of SIRS or sepsis, okay? Hey, that's quite fast. Okay, that's it. That's for my class. Usually it's a bit longer because I do the games with you guys. How okay or not? Is there any questions?
Doctor,
Yep.
I have a question.
Yep.
Just now you mentioned that for the treatment of sepsis in dogs,
Yep.
you said to avoid NSAIDs and
Oh, NSAIDs and corticoids, like steroids.
why is that? Like,
Because, usually when you give NSAIDs and steroids, if you remember, I should put this, because the inflammatory cascade, they can actually lead to further ulceration in the GIT. So yeah, so you do want to avoid NSAIDs and steroids when you know that the GIT is very sensitive, and it can actually lead to more severe condition. Yeah.
so we have to confirm if the GIT is sensitive or not.
No. Usually, that's why when you have a condition of sepsis, you would avoid, because you know they are in that kind of state. You get what I mean? Mm.
Okay, thank you, Doctor.
Sorry?
Thank you.
Okay. Anyone else have any other questions? I do hope you guys can try that Quizlet, because I think it will make you, because of the sum of the games. But I do wish you guys can give me feedback. So if it's helpful or not, if not, then maybe we can try some other things. I should have done quiz today. Can? Any other questions? If not, I think you guys can go for lunch. Or you have another class at 1. Do you have class at 1?
No, we don't.
No, doctor.
No,
This afternoon? How about this afternoon?
we have English IELTS class.
Oh, IELTS class. Okay, then that's it from me. If you have any question, you can put on Padlet. I already put the notes there. Okay. And there's some videos. If some of you find any other good papers or good videos, you can just post on that Padlet, and then you can share. Okay.
Okay, doctor.
All right. Thank you, guys.
Thank you,
Okay.
doctor.
Bye bye.
Thank you, Doctor.
Thank you, doctor. Assalamualaikum.